Hello, this is Dustin Stearns with my IRB proposal of vitamin D deficiency in kids with psoriasis ages 7 through 18. What is vitamin D and why do we need it? Overall health depends on many factors, including having an adequate supply of vitamins and minerals. Vitamin D is extremely important, not to just strengthen your teeth and bones, but also to help you avoid several potentially serious diseases. Exposure to sunlight is required for your body to manufacture vitamin D. You can also obtain the vitamin from certain foods fortified with vitamin D or from supplements. Vitamin D is fat soluble, which means the body can only absorb it when consumed with foods that contain fat, like avocado, butter, or beef. People who have trouble absorbing fat may in turn be predisposed to vitamin D deficiency, which carries its own set of risks. There are three different ways we can acquire vitamin D: through supplementation, food, or sun exposure. How much varies, as far as the sun is concerned, but supplementation, according to the Vitamin D Council, you should get 1,000 international units per 25 pounds of body weight. Now, this is kind of, everyone disagrees on this, but the current consensus states that it should be somewhere in the neighborhood of 10,000 international units. How do we become deficient in vitamin D? Although many individuals typically obtain adequate amounts of vitamin D through sunlight exposure and dietary sources, some individuals may be at a greater risk for deficiencies, especially during the winter months. According to the U.S. National Center for Health Statistics, some studies report that an estimated 70% of individuals in the United States may be considered vitamin D deficient. While it is known that skin exposure to sunlight is the main source of vitamin D production, in fact, more than 80% of systemic vitamin D3 derives from epidermis, and the other 20% is obtained through the diet from animal D3 or plant D2 and through drug supplementation. Depending on where you live, your sun exposure and during the winter time may be minimal, leading to lower levels of vitamin D. Vitamin D3 deficiency can harm your mental health, but it is also true that not getting enough vitamin D may raise your risk for other diseases and conditions. Accumulating laboratory evidence has documented that vitamin D deficiency is correlated to the onset and progression of many chronic diseases. Psoriasis. Psoriasis is the most prevalent autoimmune disease in the U.S. According to current studies, as many as 7.5 million Americans, approximately 2.2% of the population, have psoriasis. 125 million people worldwide, 2 to 3% of the total population, have psoriasis, according to World Psoriasis Consortium. Studies have shown that between 10 and 30% of people with psoriasis also develop arthritis. Psoriasis is not a cosmetic problem. Nearly 60% of people with psoriasis reported their disease to be a large problem in their everyday life. Patients with moderate to severe psoriasis experience a greater negative impact on their quality of life. Psoriasis has a greater impact on quality of life in women and younger patients. What causes psoriasis? Honestly, nobody completely knows, but there's a few educated guesses, and genetics is one of them. About 1 out of 3 people with psoriasis reported having a relative with psoriasis. If one parent has psoriasis, a child has about a 10% chance of having psoriasis. If both parents have psoriasis, a child has approximately 50% chance of developing the disease. Immune system. T cells also attack the body's skin cells. This attack causes the body to make new skin cells more often. The extra skin cells pile up on the surface of the skin, and you can see the psoriasis. Vitamin D and autoimmune disease. Over the last 3 decades, it has become clear that the role in vitamin D goes beyond the regulation of calcium homeostasis and bone health. The purpose of this study is to see if an increase in vitamin D can help with psoriasis outbreaks in kids ages 7 through 18. The goal of the study would be to examine the relationship between increasing vitamin D in several different ways in kids in psoriasis conditions. The hypothesis is increasing children's vitamin D levels above the recommended daily allowance will help kids manage their psoriasis. A review of the literature. As far as a lack of sun exposure, research suggests that kids and families are afraid to be exposed to too much sun. Under normal conditions, the skin is able to supply the body with 80 to 100% of the vitamin D requirements. Excessive UVR exposure accounts for only 0.1% of total global burden of disease and disability-adjusted life years, according to the 2006 World Health Organization. Physical activity among children has never been lower. The results from a clinical review published in the Journal of American Osteopathic Association find nearly 1 billion people worldwide may have deficient or insufficient levels of vitamin D due to chronic disease or inadequate sun exposure related to sunscreen use. The study also found that nearly 95% of African American adults may have vitamin D deficiency or insufficiency. Vitamin D variations among races are attributed to differences in skin pigmentation. Does supplementation with vitamin D help? Vitamin D supplementation is of particular interest to nutritionists for important reasons. First, besides its topical use, oral vitamin D supplementation represents an important adjunctive treatment option for psoriatic patients. Second, vitamin D supplementation may be very important for the prevention of psoriasis-related comorbidity. Methods of my study. Kids will be recruited from the Washington, D.C. area and surrounding area. 90 kids ages 7 through 18 diagnosed with moderate to severe psoriasis will be participating in the study. They must be registered with a certified dermatologist and the National Association of Psoriasis Foundation. A detailed questionnaire of 60 questions pertaining to his or her outbreaks. The study will be 1 year in duration. Blood will be drawn at the beginning of every month at the dermatologist. The initial baseline of vitamin D will be taken. Weekly pictures taken of progress or regression will happen at the dermatologist's office. The daily supplementation of D3 vitamin of 5,000 international units per day. Daily 1 hour sun exposure or 10-minute UVB exposure to the affected areas. What are the risks involved in this study? The risks will be that blood will be drawn 12 times a year. A lot of kids are scared of that. This could be stressful for children that age. Toxicity, with too much vitamin D. Any patient showing signs of toxicity will be immediately removed from the study. Benefits of doing this study for all parties is that there's possible cure of lesions or infected areas. Another benefit could be someone's confidence. If their psoriasis conditions go away, their confidence will boost dramatically. There will be a loss of insecurity. And there's also several associated benefits of increasing vitamin D in the body. Confidentiality. A secure email system will be used. It'll be a secure network, and it will also be encrypted. Data analysis. Repeated measures ANOVA will be used to compare monthly blood work and baseline. Expected results. With this study, we are expecting that increasing vitamin D levels, psoriasis outbreaks and conditions will dramatically improve. We not only are going to overexpose everyone to UVB lamp, sun exposure, and supplementation, but we will also be adding foods to this as well. So the vitamin D levels will increase dramatically throughout this whole program. And the expected results will be that the psoriasis outbreaks will potentially either go away or severely decrease in the amount of outbreaks and the severity of the outbreaks. Thank you very much.